eating and sleeping disorders. We are going to learn about some of the eating and sleeping disorders which can affect patients. We will discuss some of the potential causes for these disorders, the symptoms which they can cause, and a few potential treatments which may help sufferers. Please remember that medication can only be prescribed by GPs, psychiatrists, or nurse prescribers. Topics to be covered: eating disorder, anorexia nervosa disorder, bulimia nervosa disorder, sleep, breathing-related sleep disorder, circadian rhythm sleep disorder, narcolepsy disorder, primary hypersomnia disorder, primary insomnia disorder, sleep paralysis. Eating disorder. Eating disorders are psychiatric disorders which can lead to many medical issues and even death. They are caused by a misconception by the patient about their body image. Usually, the patients believe that they are fat. Food often becomes an obsession for patients with eating disorders. Eating disorders often coexist with other psychiatric disorders such as depression and anxiety. Sufferers will constantly feel pressured to achieve a perfect body, regardless of what is realistic. Eating disorders tend to occur in women more often than men. Anorexia nervosa disorder. Patients who suffer from this disorder will strongly believe that they are overweight, regardless of their actual weight. It is considered a psychiatric disorder, as patients view themselves negatively and may exercise excessively or starve themselves to try and lose weight. They may only eat certain low-calorie foods or might skip meals. Patients may chew food but might swallow very small amounts, and often only if pushed by others. Causes. It is difficult to pinpoint exact, specific causes of anorexia nervosa disorder. Some researchers believe it may have obsessive-compulsive elements. Patients obsess over achieving the perfect body. The disorder may also be influenced by constant adverts based on body perfection and self-image. It is thought that peer pressure may have some impact on people as well. It may come from a combination of all these factors. Symptoms. There are many different symptoms of anorexia nervosa disorder. Some of these include brittle hair, dry skin, fatigue, denying feeling hungry, dizziness, fainting, swollen legs, refusal to eat, withdrawal from others, using or increasing use of laxatives, focus on food, major weight loss, no menstruation, feeling cold, depression, irritation, constipation, fast, slow, or irregular heartbeat, arrhythmia. Treatments. There are several options for treating anorexia nervosa disorder. In some cases, combining them may be the most effective approach. Treatments include group therapy, sharing experiences with others who suffer from the same disorder. Participants may be able to offer each other support and learn from each other. Cognitive behavioral therapy. This usually focuses on helping patients change their behavior and approach food in a different way. Inpatient treatment. If a patient is not seeking help or refusing to admit a problem, they may need to be treated within a hospital to ensure they are getting enough nutrition. This will usually be combined with therapy. Bulimia nervosa disorder. Bulimia nervosa disorder is also connected with weight. In this case, patients are usually very frightened that they may become overweight. patients usually binge on food, eat in very large amounts, and then try to counteract that by purging the food or exercising heavily. The two types of bulimia are: purging bulimia. The patient uses laxatives, self-induced vomiting, enemas, or diuretics to rid themselves of food they have binged on. Non-purging bulimia. After binging on food, the patient goes on a strict diet with excessive exercise or periods of fasting. Causes. The causes of bulimia nervosa disorder aren't entirely clear, but there are some potential contributory factors. Some researchers believe there may be a genetic element, with first-degree relatives at high risk. It is also possible that obsessive-compulsive personalities are more vulnerable to the disorder. Again, high amounts of peer pressure and the pressures of body-conscious advertisements may add to risks. Bulimia can also be caused by a desire to excel at sports. Symptoms. There are many symptoms of bulimia nervosa disorder. These include misuse of enemas, laxatives, and diuretics, especially after eating. Excessive exercise. Excessive focus on body and weight. Refusal to eat in public. Going to the bathroom directly after eating. Scarred or sore hands from inducing vomiting. Fear of weight gain. Injured gums from inducing vomiting. Poor appetite. Treatments. There are several possible treatments for bulimia nervosa disorder, all involving therapy. It might be treated through dialectical behavioral therapy, DBT, a type of talking therapy. This is aimed at helping patients manage stress and emotions more effectively. Group therapy. Patients with bulimia nervosa disorder may benefit from an opportunity to share their experiences with other sufferers and give and get support. Cognitive behavioral therapy, CBT, focused on helping patients alter their abnormal behavior. Inpatient treatment. Patients who do not recognize their condition may need to be monitored in a medical setting to ensure they are getting enough nutrition. Sleep. Sleep is the period in which we are unconscious and all voluntary muscular and sensory activity ceases. Most people sleep for approximately 8 hours a day. Some psychological functions, such as breathing, continue during sleep. They often change somewhat, for example, slowing down. It's not known why we need to sleep. It is thought that it may be to increase the body's ability to repair itself. Many major restorative functions occur during sleep. These include tissue repair, protein synthesis, and muscle growth. It is also thought to help with memory and removing adenosine. Adenosine is a result of neural activity and induces sleepiness. Breathing-related sleep disorder. This disorder is when a patient's normal sleep patterns are disturbed due to irregular breathing. They may stop breathing during sleep. This causes excessive sleepiness during the day. Patients often have interrupted sleep and do not feel refreshed. They may fall asleep during relaxing activities or active activities. This disorder usually occurs over a period of years and may not be detected until it is disrupting the patient's daily activities. Causes. Breathing-related sleep disorder could have several causes, but the most common seems to be obstructive sleep apnea syndrome (OSAS). This is where the airway is blocked for up to 60 seconds by an enlarged soft palate or tongue. This is often due to obesity. Children with enlarged tonsils may suffer from the disorder. The blockage leads to increased carbon dioxide levels in the blood. The patient will wake up to reposition, opening the airway, and then fall asleep again. This cycle can repeat throughout the night, and the patient may be unaware. Symptoms. The symptoms of a breathing-related sleep disorder may include snoring due to partial blockage, high irritation levels, fatigue, difficulty focusing on anything, sleepiness during the day, headaches, memory issues, long silences between snores, naps, airway blocked by tongue or palate. A patient may have a breathing-related sleep disorder and not necessarily experience all these symptoms. Treatments. Treatment usually involves working out why the airway is getting blocked and treating the underlying cause. For this, it may be necessary to do a polysomnogram, PSG. This means electronically monitoring the psychological activities while the patient sleeps. Treatment may involve addressing obesity issues, if they are the cause. This will reduce the size of the tongue or palate and should help prevent the obstruction from occurring. Patients may occasionally require continuous positive airway pressure, CPAP, therapy. This involves the patient wearing a mask through which continuous airflow can be delivered. Circadian rhythm sleep disorder. This sleep disorder occurs when a patient is unable to maintain a steady schedule of sleep that allows them to complete daily tasks. The patient is able to get enough sleep, but may sleep at erratic and unusual hours. The circadian rhythm dictates when a person sleeps and wakes up. Causes. Disruption to sleep can be caused by intrinsic and extrinsic factors. Intrinsic factors include non-24-hour sleep-wake syndrome. The patient sleeps later each day. Advanced sleep phase syndrome, SPS. The patient struggles to stay awake in the evening and can't remain asleep in the morning. Irregular sleep-wake rhythm. The patient sleeps multiple times in a day, at various times. Delayed sleep phase disorder, DSPD. The patient sleeps and wakes up later than normal. Extrinsic factors could be jet lag. The patient has changed the time zone. Irregular work shifts, working at night or working irregular hours. Parental sleep deprivation. Parents may miss out on sleep while a newborn baby adjusts to its parents' circadian rhythms. Symptoms. Insufficient sleep. Inability to fall asleep before midnight. Sleeping at work or during the day. Difficulty with daily activities. Using multiple tools to wake up, for example alarms. A general sense of not feeling well. Fatigue. Patients must have recurring sleep issues for them to be diagnosed with circadian rhythm sleep disorder. It may be necessary to do a sleep study to properly diagnose this disorder. Treatments. There are a few different options for treating circadian rhythm sleep disorder. Patients might be helped by bright light therapy. This involves using an intensely bright light to adjust the patient's sleep cycle by 1 to 2 hours per day. Chronotherapy. This involves adjusting the sleep schedule by 1 to 2 hours per day until the schedule suits the patient's daily activities. Behavior therapy. This focuses on addressing behaviors which can contribute to the circadian rhythm sleep disorder. Narcolepsy disorder. This disorder occurs when the patient suddenly falls into deep sleep for up to 20 minutes. The patient may suddenly go limp, or may experience paralysis just before sleeping, or just after waking. The patient may experience extremely vivid dreams or even hallucinate. There is no warning before the patient falls asleep. The symptoms of narcolepsy disorder may get worse and then stabilize as time passes. Causes. Certain cells in our brains produce hypocretin, which is involved in sleeping and waking. People who often suffer from narcolepsy disorder have lower levels of hypocretin neurotransmitter. They may have lost some of the brain cells responsible for producing it. These cells may be lost because of a brain injury, an infection, or a tumor. It's also possible that autoimmune disorders could cause loss of the cells. Some researchers think genetics may cause lower concentrations of hypocretin. Symptoms. The most obvious symptom is falling asleep without warning at apparently random moments. However, there are a few more indicators of narcolepsy disorder. These include disruption of sleep at night time, excessive sleepiness during the day, sudden loss of muscle tone, sleep paralysis. Patients must have experienced daily attacks of sleep for at least 3 months before they can be diagnosed with narcolepsy disorder. Treatments. There is no cure for this disorder, so treatment aims at managing the symptoms and minimizing the impact which they have on the patient's life. The patient may benefit from group therapy. Although this will not address the issues narcolepsy disorder causes, it can help ensure the patient does not feel lonely or get isolated as a result of the disorder. Some medications may help manage the symptoms. These include Xyrem, sodium oxybate, Ritalin, methylphenidate, and Provigil, modafinil. Primary hypersomnia disorder. This disorder results in patients being excessively sleepy during the day. This sleepiness must not be caused by secondary hypersomnia disorder. This means there is an underlying factor such as depression, a medical disorder, or an environmental change like work shifts. There are 2 kinds of hypersomnia disorder. Primary hypersomnia disorder, where the patient experiences symptoms at all times. Recurring hypersomnia disorder, where the patient experiences periods of remission several times in a year. Causes. It is not entirely clear what causes primary hypersomnia disorder, but researchers have a few different thoughts. Some believe that a dysfunction in the autonomic nervous system is the cause. Others think that a viral infection may contribute to it. Some researchers think that disruptions at night stop patients experiencing REM, rapid eye movement, sleep. This causes the patient to feel tired and sleep during the day. Symptoms. There are quite a few symptoms of primary hypersomnia disorder. These include slow responses when waking up, disorientation, difficulty waking up, excessive daytime sleepiness, even if waking from nighttime sleep is easy, excessive sleep at night, irritation upon waking. Treatments. To be treated for primary hypersomnia disorder, a patient must have experienced daytime sleep or excessive sleepiness for a month or less, clinical distress and difficulty with daily tasks as a result of poor sleep, excessive sleepiness for more than 3 days several times a year, for more than 2 years, for recurrent hypersomnia disorder,